Well, Africa's main public health agency says that it has a plan to make 10 million Mpox vaccines available for use across the continent. Last week, the World Health Organization declared Mpox a global public health emergency for the second time in 2 years over concerns about a new variant. Well, the Africa Centre for Disease Control and Prevention says 10 million vaccines will be made available from next week. Now, there has been a rise in reported Mpox cases in Central and Eastern Africa, specifically in Burundi, the DRC and the Central African Republic. Our correspondent, Simi Jalauso, has an update.
There has been some good news with regards to the efforts to curb the outbreak of the Mpox disease on the continent. 2 African countries have said they've secured vaccines and they'll be made available as early as next week. This is despite the vaccines not being tested on this new strain. Those countries are Nigeria and the Democratic Republic of Congo. Nigeria says it's expecting 10,000 doses from the US, and they will target healthcare workers in regions that have been affected by the outbreak. The Democratic Republic of Congo says it's expecting 50,000 from the US and 3.5 million from Japan. And they will prioritize children because they are at a higher risk of contracting and dying from Mpox. The Africa CDC Director General, Dr. Jean Kaseya, reiterated the agency's plan to ensure 10 million doses of the vaccine are made available on the continent by the end of 2025, although he did mention the challenge of getting those doses to regions in the eastern part of the Democratic Republic of Congo that are experiencing an armed conflict. He also spoke about local manufacturing and a partnership with a Danish manufacturer, saying that getting those vaccines made on the continent will not only increase supply, but also reduce the cost.
Simi Jalauso reporting there. We can speak now to public health doctor and World Health Organization's spokesperson, Dr. Margaret Harris. Very good to have you with us, Margaret. So, of course, we've been hearing that news, the DRC, other African nations starting to vaccinate against Mpox next week if everything is in place on time. What impact do you expect that to have?
Nice to see you, Helena. And it is good news because one of the things that has been a concern is that there were limited amounts of vaccine and they weren't where they're needed, which is in Africa, particularly in the parts of Africa in Eastern DRC where the outbreak is raging. And it is really important that they get to the specific target groups. And I heard in your report that that's already been identified, that those most at risk, those most exposed are the ones that will be targeted.
I think one of the questions on many people's minds right now when they're listening to this information is, yes, they've seen Mpox before, but we've also got that information that this is a new strain. So what do we need to know about this particular strain of Mpox?
And this is a very important aspect. It's called Clade Ib because it's arisen from the first form of Mpox we knew in humans, which was in the Congo Basin, was in the Democratic Republic of Congo and Central Africa. And the one that went worldwide 2 years ago was Clade II, and that actually arose from West Africa. But what we're seeing now, this Clade IB, it's showing some different characteristics. It's transmitting very, very rapidly. And unfortunately, we are seeing a high death rate, particularly among children. So these are things that have concerned us very much. And that's why we really call the public health emergency of international concern to galvanize world efforts to understand the unknowns, to get the scientific community together to deal with the unknowns, and to also galvanize resources.
I mean, that's the important point to make, isn't it, about declaring that public health emergency of international concern, that it does then get those additional resources, tries to close those knowledge gaps. But I just wonder, Margaret, you know, what you would say to people travelling to the area, what people should be aware of, particularly for those people who might not have had the vaccine. And of course, we know vaccines aren't always a silver bullet.
Well, precisely. Now, at the moment, it's more about if you're traveling to the area, you should look at your risk. Are you going to an area where there's current transmission? If so, understand that this is spread by close physical contact. So ensure that you're not being in close physical contact with those who are infected. Now, some of that close physical contact involves sexual contact. So if you're considering sexual contact, you must be really serious and have protected sexual contact or no sexual contact where there's ongoing transmission. As for getting vaccinated, really we want to see the vaccines being used in the highest risk groups at the moment. That's the people infected in the countries where the transmission's happening.
I mean, I suppose one thing looking at all of this, Margaret, is the fact, I mean, you and I have been speaking about epidemics, pandemics for a very long time, thinking about Ebola, and then also moving on to MERS and COVID and so on. I just wonder, you know, is there the opportunity here that countries have learnt lessons from COVID?
Yes, in fact, I've cast my memory back to when we both worked together on Ebola. Indeed, a lot of lessons have been learned in a very hard-learned lessons. One of the most critical ones is respect the communities where an outbreak is occurring. Listen to them, first of all, listen to what they understand and ensure that they know what needs to be done. Don't just impose your ideas from outside. So while, yes, we want the world to come together and bring the resources, one of the most critical things is really understanding how the transmission's occurring, who it's occurring in, and what's available to the people who are getting sick. Are they getting the help they need? Because if they're not going to come to the official authorities. We saw this very much with Ebola. The infection will go underground. They will turn to other sources of help, and they will not be the sources that will necessarily help stop the spread.
Yeah, as you say, that trust is just so key in all of this. Dr. Margaret Harris, good to see you again. Thanks for being with us.
Thank you.